Okay, think about this for a second. The sheer amount of biological engineering required just to let you casually walk across a room is absolutely mind-blowing. Today's explainer is a deep dive into the mechanical trade-offs of the human body. We're going to focus on the architectural marvels that literally make all of our movement possible, our joints. But before we even look at the blueprints, I want you to think about a baffling medical mystery that we are absolutely going to solve by the end of this explainer. Why does joint pain sometimes show up in your skin? It seems totally counterintuitive, right? I mean, the problem is deep inside the mechanics of the joint, but the pain registers right there on the surface. Keep that little puzzle in the back of your mind as we go. So here is exactly how we're going to unpack all of this today. First, we'll look at the joint blueprint. Second, movement and mechanics. Third, the stability trade-off. And finally, number 4, wear, tear, and pain. All right, let's jump right into section 1, the joint blueprint, which is the literal foundation of human movement. You know, the absolute biggest structural difference that forms the foundation of our entire joint blueprint really comes down to one simple thing: a joint cavity. Synovial joints are defined by having this cavity. It's a fluid-filled space right between the connecting bones. Cartilaginous joints, on the other hand, don't have one at all. Their bones are directly united by cartilage. And believe it or not, that single structural variation completely dictates how much a joint can move and how it's going to function under stress. Now, imagine someone walks into a clinic with a super stiff, noticeably swollen knee. That's an inflamed synovial joint. We know there's a cavity in there, but we have to look past the surface. What specific structure inside that joint is actually producing all that excess fluid and causing the swelling? Well, the rapid-fire answer is the synovial membrane. It's this highly specialized tissue that lines the inside of the joint cavity. Under normal conditions, it produces just the right amount of fluid to keep things perfectly lubricated. But when it gets irritated or inflamed, it acts like a biological factory that just goes into absolute overdrive. It pumps out excess fluid way too fast, which creates that intense pressure, stiffness, and visible swelling. Moving right along to section 2, movement and mechanics, or basically how our bodies are actually engineered to move through space. Let's say a doctor is evaluating a patient who just can't do that big, sweeping, circular windmill motion with their arm. In medicine, that's called circumduction. To figure out what's wrong, they can't just look at the whole movement. They have to break it down. So if a patient cannot perform circumduction, which basic foundational movements must be carefully assessed to find the failure? To fix that complex movement, you actually have to assess 4 basic mechanical gears: flexion, extension, abduction, and adduction. You see, circumduction isn't just one magic, independent action. It's actually a rapid, sequential combination of those 4 specific gears working in perfect harmony. If even one of those basic movements is sticky or restricted, the entire circular motion just grinds to a halt. You have to fix the individual gear to restore the whole machine. And to keep this whole mechanical system from destroying itself, our joints rely on crucial structural additions like articular discs and menisci. These are clinically critical because they handle the really heavy engineering tasks: improving joint congruity, distributing heavy physical loads, and assisting with overall stability. Think of them as your body's vital shock absorbers. They make sure the bones fit together like perfect puzzle pieces, protecting the system from being crushed under the immense daily pressure of just walking or running. Okay, part 3. This is where it gets really fascinating. The stability trade-off, mobility versus security. Your body is basically a masterclass in compromise. It's constantly balancing your freedom to move against your need for structural security. Just look at the ultimate trade-off between your shoulder and your hip. The shoulder is incredibly mobile, but much less stable because of its shallow cavity. It prioritizes letting you reach in almost any direction, but that freedom means it's pretty susceptible to dislocation. The hip, though, it completely sacrifices that extreme mobility in favor of a deep, tight fit. It needs that secure, bony stability to safely bear your body weight. Now, when we talk about the static cables holding this whole operation together, we're talking about passive stability. Think of your ligaments exactly like the thick, rigid steel cables on a massive suspension bridge. They don't flex or contract, they just hold the line. If a ligament snaps, your joint immediately loses its passive, built-in security, rendering the whole bridge structurally unsound. But hey, what happens when we look beyond those passive ligaments and look at the active muscles surrounding a joint? Why would the paralysis of those surrounding muscles dramatically reduce overall joint stability, even if the ligaments are 100% perfectly intact? It all comes down to muscle tone. Muscle tone acts as a critical dynamic stabilizer for synovial joints. Even right now, if you're just sitting or standing perfectly still, your muscles maintain a baseline level of tension. That constant active firing acts as a dynamic support system that braces the joint from all sides. If paralysis happens, you lose that active brace completely, and the joint becomes dangerously loose. Which brings us to our final section, Part 4, Wear, Tear, and Pain. Basically, what happens when this incredible biological engineering fails. If you've ever tweaked a knee or an elbow, you know the deep frustration of this next question. Why does articular cartilage seem to take absolutely forever to recover? You rest, you follow all the doctor's orders, yet the pain just lingers. What makes this specific tissue so incredibly stubborn? Well, the brutal biological truth is that cartilage is avascular. Avascular literally means it has absolutely no blood vessels, zero. Without a direct blood supply to quickly rush in oxygen, nutrients, and repair cells, the cartilage is basically left to fend for itself. It heals at a grindingly slow pace because it relies entirely on the slow diffusion of nutrients from the joint fluid around it. And what about friction? Imagine a carpenter kneeling on hardwood floors day after day. That constant, repeated friction over a bony prominence causes a structure called the bursa to become highly inflamed, resulting in really painful swelling. A bursa is essentially a fluid-filled sac that's supposed to be a friction-reducing cushion to help tendons glide smoothly. But with enough mechanical stress, it turns into a very painful warning system. All right, this brings us all the way back to the mystery from the very beginning of our explainer. We've talked all about these deep internal mechanics, but why does your skin actually hurt when the joint deep underneath it is the real problem? Why does your nervous system send such a confusing, misdirected signal? The answer is a fascinating anatomical principle called Hilton's law. It basically comes down to crossed wires caused by a shared segmental nerve supply. You see, the exact same nerve that provides sensory info to the deep joint architecture is the one supplying the skin directly above it. So when the joint is screaming in pain, that signal travels up the shared pathway, and your brain simply misinterprets the SOS as coming from the skin itself. It's an incredible biological quirk. So, stepping back and looking at the big picture, your joints truly are a masterclass in biological trade-offs. From the synovial membrane actively manufacturing fluid to the dynamic muscle tone keeping you upright, every single piece of your anatomy is constantly prioritizing either incredible mobility or unbreakable security exactly where you need it. Knowing how vulnerable all these structures can be, from that slow healing avascular cartilage to an easily inflamed bursa, how are you going to treat your own biological engineering from this point forward? Knowing the fragile, beautiful balance of dynamic and passive stability holding you together, how will you protect your biomechanical architecture today? Keep that in mind the next time you take a step. Thank you so much for joining us for this explainer.